do you know about the ankle joint?
I know that ankle joint is hinge synovial joint. That its anterior surface of talus is wider than posterior. Also, lateral articular surface of talus articulates with inferior medial surface of lateral malleolus. Yeah, malleolus. Also, medial articulate surface of talus articulates with inferior lateral surface of medial malleolus. Also about ligaments, there are two types. This is medial deltoid and lateral deltoid ligaments, but they are divided into three maybe types. So medial deltoid ligament is divided into Tibiotalar part, anterior and posterior, Tibionavicular part, and Tibiocalcaneal part. Lateral deltoid ligament is divided into talofibular, anterior and posterior, and Calcaneofibular ligament.
Okay. All right. So there's three things that I'm gonna point at. Okay. Number one, you said when you were talking about the articular surfaces of the bones, somewhere you mentioned inferior lateral articular surface of the medial malleolus. We just say lateral surface of the medial malleolus. This inferior thing, no. And then you said instead of saying posterior anterior Tibiotalar, you said posterior anterior Tibiocalcaneal. Okay. So the posterior anterior is for Tibiotalar part. Okay. And the third thing you mentioned, I think you just need to focus more on the names of the ligaments, but you're good. You have the idea. Okay. Okay. So I will question and you will answer very quickly. So you have which bones?
Fibia, tibia, and talus.
Okay. Articular surfaces, please, again.
Medial malleolus, lateral malleolus, and talusal articular surface.
Okay. So can you tell me how does the tibia articulates with the talus?
The talus. Medial articulate surface of talus articulates with lateral surface of medial malleolus.
Nice. The lateral surface of talus?
Lateral surface of talus articulates with medial surface of lateral malleolus.
Nice. What about the superior surface of talus?
Superior surface of talus articulates with I think with medial malleolus.
No. So the surface articulates with inferior surface of inferior articular surface of tibia here. So you have
I gotcha. Okay, yeah.
So you have the tibia articulates with two spots on the talus. It makes like this. So here, inferior surface of tibia articulates with superior surface of talus. And then you know the rest. And then the ligaments, please, medially. What's the biggest name, the big name for the parts or the ligaments medially? What is the big name?
Medial, I think Tibiocalcaneal parts.
No, so I told you medially, you have a big ligament called deltoid ligament.
You mean this one? Okay.
Deltoid ligament. Deltoid ligament is separated into 4 ligaments. What are they?
Tibionavicular, Tibiocalcaneal,
yes,
and Tibiotalar,
Yes.
posterior and anterior.
Nice. Laterally?
Laterally, anterior talofibular.
Yes.
Talofibular ligament.
Yes.
Posterior talofibular ligament and Calcaneofibular.
Amazing. We're done with this point. Good? You feel good about it?
Yes.
Okay, that's the ankle joint. Next one I gave you, I think it was the wrist joint. Okay, there we go. So wrist joint, it can be hard actually. No, wrist joints. Okay, let's not start this one. I don't wanna annoy your head so much today. Yeah, this is a good point. Okay. Or maybe wait. Let me get the list. Just give me a second. So you have officially done 10 points now because you finished the ankle joint, okay? Number 11, I want to choose a good one that we can just finish quickly. Skeleton of the pelvic gird. This is actually nice. No, not this one. Classifications of the skull bone, bones of the cranium, nasal cavity, unpaired bones, skeleton of the shoulder gird, orbital cavity, paired bones, rib cage, joints of foot, foot and bone, the ribs, joints of the skull, hip joints. Yes, hip joint is actually nice. I like it.
Hip joint, okay.
Hip joint. There we go. Easy. Okay. So I've shown you maybe the hip joints, and the hip joint is basically between the head of the femur and the acetabulum that exists within the pelvic bone. Okay. Okay. So here the hip joint, it's a ball and socket joint, as we know, because the head of the femur is the ball and the socket is the acetabulum. Here, head of femur and acetabulum. Okay. Boom, acetabulum, head of femur. These are the parts, and the joint type is ball and socket joint. Okay. Now, the structure of the joint allows flexion. It allows for extension, adduction, abduction, medial and lateral rotation. So remember when I told you, Nastia, that the ball and socket joint has so much movements? When he asks you in the test, what are the movements allowed in ball and socket? These are the things you should say. So please write them down. You have socket joint allows for flexion, extension, adduction, abduction, medial and lateral rotation.
Okay, 1 second.
Okay. And the articular surface. Okay, so You got them?
Mm-hmm.
Okay. The articular surfaces, because we want for every joint type, bones involved, movements, articular surfaces. So the articular surfaces is the acetabulum and the head of femur. We know it. Now it says, remember when I told you that the glenoid cavity kind of extends a labrum to probably be able to hug the head of the humerus? It extends its arm like that to hug, right? Remember or no?
Kinda.
Remember we studied the glenoid labrum?
Yeah.
Yes. So here in the same thing, we have the acetabular labrum. And I will show you everything now. Extending between the fovea of the femur head and the acetabular notch is a ligament of the head of femur. I'll show you this. There is a ligament called ligament of head of femur that basically pokes through fovea of femur's head. There's a hole in the femur head where a ligament pokes through. And this ligament comes from the acetabular notch. Okay? I will show you everything. There is 4 ligaments here. Number 1, transverse acetabular ligament, iliofemoral ligament, ischiofemoral ligament, pubofemoral ligament. Okay. Yes. First, transverse acetabular ligament. And then there's a ligament that is called the ligament of the head of femur. Then there's ligaments outside called iliofemoral ligament, ischiofemoral ligament, pubofemoral ligament. So ilio, ischio, pubo, they are the bones that make up the pelvic gird. Ilium, ischium, pubis. And so iliofemoral, ischiofemoral, pubofemoral. Easy.
Yeah.
Okay. Let me just show you pictures of it so that you can maybe. So hip joint. Here. Now, as I said, you have in the hip joint, the bones involved are the femur and the acetabulum, or you can say the pelvic gird. Okay, so femur and acetabulum. The acetabulum is just like the glenoid cavity. It's a cavity. It's the socket that the head of femur articulates with. Okay? Now, you have the acetabular labrum that extends a little bit to make the labrum, to make the acetabulum surface area larger. Okay? And the head of femur articulates with this. So we know the bones involved now. Second thing we want to know, type of joint. As we know, it's ball socket. Okay? طيب. Now we want to know the articular surfaces. You have head of femur and acetabulum. Okay? Fourth, we want to know movements. It's a ball and socket. So how does it move? You need to know flexion, extension, adduction, abduction, lateral and medial rotation. Easy?
Yeah.
Now ligaments. You have 4 or 5. And one of them is called ligament of head of femur. Comes out of here and pokes through. There is a hole here called fovea of head of femur. This ligament enters. That's number 1. Okay. The other ligaments here, look. You have, this is the pelvic gird. You have ilium, pubis, ilium, pubis, ischium, okay? You have iliofemoral, pubofemoral, and ischiofemoral. These are the movements. Again, iliofemoral, pubofemoral, and then you have ischiofemoral. There's maybe a better picture. Just give me a second. Hip joint ligaments. There. Let's see. Here. See? Iliofemoral, pubofemoral, because this is ilium, this is pubis. They're separated here. There's like a fine line that separates them. So pubofemoral, iliofemoral, okay?
I see the text. I do not see the picture.
Ah, really? Okay. Just give me a second. I'm like, oh. Just give me a second. There. I think I know why.
You just showed this between words, and I'm like, wow, how to.
Here, I was
how to
actually pointing. Yes, I was actually pointing at this. I didn't fuck. All of this time, you were actually not looking at the pictures. Okay, so I was explaining here.
Okay.
Here. Sorry. Damn, I didn't know. Okay. You have femoral. Okay, first bones. Femur, acetabulum. Okay? That's the femur, that's the acetabulum.
Yeah.
Okay, second thing, we want to know what type of joint. Ball, socket. That's the ball, that's the socket. Easy?
Yes.
Okay. Third thing, we want to know type of movements. We have flexion, extension, lateral and medial rotation, adduction, abduction. That's the movement of ball and socket, okay? And then finally, we want to know articular surfaces, and it's very clear. Head of femur and acetabulum. Deal?
Yeah.
Now we want to know ligaments. Ligaments, the first one is this ligament that enters the head of femur through a hole called fovea. Okay, that's number one. Number two, you have here. Or wait, yeah. No, where is it? Just image, sorry. Here. The ligaments that are involved, I told you, the ligament of head of femur that enters through the fovea, which is a hole in the head of femur. Okay, that's number one. Number two, you have iliofemoral ligament. Okay, from here to here. Then you have, this part is pubis. This part is ilium. So pubofemoral ligament. Okay? And then finally, from the back, because the back is the ischium. Here. So you have ischiofemoral ligament. Okay, you got it? Okay, so take a little bit time to maybe read what you wrote or.
Okay.
Yes. So tell me, I will ask you and you answer me, okay? You have first bones.
Ilium and hip bone, femur.
You have so two structures that make up the hip bone, the hip joint. What is it?
Acetabulum and head of femur.
Exactly, acetabulum and head of femur. Perfect. Now, the second question, you have the articular surfaces, which is the same, head of femur and acetabulum. Deal? Third, the type of joint. What type of joint is this?
Ball and socket.
Yes. How does it move?
Extension, flexion, adduction, abduction, and lateral and medial rotation.
and we want to know, yes, we want to know the ligaments now. There are 4 I mentioned.
Ligament of the head of the femur,
Hmm?
pubofemoral ligament, ischiofemoral ligament, and iliofemoral
Okay.
ligament.
One more thing. What extends out of the acetabulum to expand its surface area?
What?
It like hugs the head of the femur. What is it called?
Wait. Labrum.
Yes. So acetabular like labrum.
Yeah, acetabulum labrum.
Perfect. There we go. Easy.
Yes.
Okay, now you finished your 11th point. And if you were here, I would give you this point to take home. Where is it? Yes.
I'm kind of proud of myself.
I'm proud of you, honestly. Like you're learning things, and this is good. This is good. Okay, okay. The hip joint done. Now, shoulder gird. Like I'm choosing for you the easiest one so that you can finish them. Joints of rib cage. This one is a very interesting one, and I actually like it.
Rib cage. Okay.
Let's
Joint
see. If it's not
rib
huge.
cage.
Rib cage. Wait. Rib cage. Oh, here. And the thorax. No, let's not do this because it's actually very like I need to have this in person to show you. Sorry. I'm messing you around.
Oh no. It's okay. Don't worry.
Yes, maybe we can do the wrist joint.
Okay, let's try.
Yeah. Where is it? I'll give it to you. Yeah, let's do wrist joint. Here, wrist joints of the hand. This is 1 point. Damn. Okay, wrist joint. Wrist. Here. There we go. Can do it. It's fine. Okay. Now, the wrist joint is a synovial type of joint. Okay, we know this. Wrist joint. Okay. Allowing movements in 2 axes. It's not like a ball socket. It's wait, here. It allows for adduction and abduction, flexion, extension. Not allow for rotation. Okay. Occurs between 3 here the bones involved 3. You have proximal row of carpal bones, which are the scaphoid, lunate, and triquetrum. That's number 1. And the concave articular surface of radius 2. And then 3. This is very nice that we have actually done this. I was like, what is this? And then I remember the medially with the articular disc overlying the distal end of the ulna. So this is an important fact for you, Nasi, and I swear to God, he's gonna come to you at this. I was asked this once and I didn't know it. There is an articular disc that the ulna has that separates it from the proximal row of the carpal bones. The radius does not have that. I'll show you. I know you're confused now.
Yeah, a little.
Ulnar articular surface. Look. Just look how interesting this is. Articular. Ulnar articular disc. Look how this is interesting. Here. Near wrist. There. Just give me a second. Google is failing me, but wait. Here, probably. It's a confusing image for you. 1 second. Why is it not showing? Ulna. I hate this. Okay, wait. Ulna articulation with carpal bones. Here, maybe we can just do that. There, see? The ulna is prevented from articulating with the carpal bones by the presence of a fibrocartilaginous ligament, the articular disc. Look at here. See this?
Yeah. 1 second. Could you please not turn it off? 1 second.
Yeah. Open it for you 1 second. There. There.
Oh, it's great. 1 second. Disc. Disc and coordinate.
Okay, so now we can see through this document tells us you have 3 bones, proximal row of carpals, scaphoid, lunate, triquetrum. Easy? You have the concave articular surface of radius. So you see here, concave articular surface. And then you have the articular disc that's, wait here, medially. So medially, when we're talking medially, towards the body, so the ulna is medially, with the articular disc overlying the distal end, articular disc that underlies the distal end of ulna, with the of the carpal tunnel. Okay? So if he asks you tomorrow, or like hopefully like when you go to the tests, what bones of the carpal tunnel does the radius articulate with? You know, scaphoid, lunate. Okay. What bones of the proximal carpal row does the ulna articulate with? You know, lunate, triquetrum.
Lunate, triquetrum.
But you have to be careful and say it does not articulate directly with lunate and triquetrum. There is an articular disc that prevents it from touching them. Okay?
Yeah, this
is very important. And I'm telling you, this was one of the things he always failed people with. He's like, does the ulna articulate with the proximal row of the carpals? You just say no, separated by an articular disc. Okay, easy.
Yeah.
Okay, bones, we know. Type of joint, I think it's hinge, isn't it? Second. Wrist joint, type. Ah, yes, I remember now. This type is called condyloid.
Condyloid synovial joint.
Condyloid synovial joint. Why? It's because it allows for 4 types of movements. Hinge joint allows only flexion extension. That's it. Get it? Condyloid allows for flexion extension, abduction, adduction. Okay?
Yeah.
Okay. Now we want to know ligaments. So for ligaments, yes, okay, now I get it. For ligaments, you have, so look at my hand here. You have in this region, we have ulna, right? And on the other side, we have radius. Okay. Now it says here, palmar dorsal. What is palmar? Palmar is this side. Dorsal is this side.
Okay.
Okay. Where is ulna? It's here. Yes. So you
Yes.
have dorsal radiocarpal ligament, and then we turn on the side of the radius we have palmar radiocarpal ligament.
Dorsal side.
Yes, dorsal side we have dorsal radiocarpal ligament. Palmar side we have palmar radiocarpal ligament. And
Yeah, I'm joining it right away.
okay. And on the ulnar side, you have palmar ulnocarpal ligament. That's it. You don't have dorsal ulnocarpal ligament.
Palmar.
And then finally, you have collateral ligaments. Remember the collateral ligaments of the knee?
Collateral ligaments of the knee.
Of the knee joint. We said tibio, wait, tibio, wait.
Wait, yeah.
Yes, tibio-femoral ligament, the collateral one. So you have the tibial collateral ligament and the fibular collateral ligament. They connect the tibial femur and the fibula to femur. So here same, you have radial and ulnar. Radial collateral ligament and ulnar collateral ligament.
Okay, that's ulnar. Ulnar. Phalange. Ligament and radial.
Okay. That's the wrist joint. Okay. Now we finished the joint. This is the joint. So if he says wrist joint alone, you know it. Okay. There is a second point for this point specifically, point number 15 of your oral, joints of the hand. So what does this mean? They want you to know the joints between individual carpal bones and joints between proximal and distal rows, joints between the distal and the metacarpal, joints between the metacarpal and the phalanges. So you have the carpal joints, the carpometacarpal joints. Then you have the first metacarpal thumb joint. This is unique. But let's go first here. Metacarpophalangeal joint and interphalangeal joints. Do you get it? So the carpal joints, here it says, Just give me a second. They're joints between the carpal bones, and you have function. You can read it. Or you have carpometacarpal. This is a joint that connects the carpal bone to the metacarpal. Which metacarpal bone? Distal rows. So we're talking about hamate, capitate, trapezium, trapezoid, trapezium. And those have joints with the first, second, third, fourth, fifth metacarpal bones, okay?
Uh-huh.
And then you have metacarpophalangeal joints between the metacarpal bones and the phalanges. Which ones? The proximal phalanges. Okay.
Okay.
And then you have interphalangeal joints between proximal, intermediate, distal. Okay.
Yes.
Okay. Now, of course, they're joints, right?
Of course.
So each joint, we need to know how it moves, what's its type, how what bones are involved. You know what I mean?
Yeah, I
Okay.
suppose.
This is why anatomy is hard. However, it's interesting, you know. It might take all of your brain cells, but once you know it, it's easy. Okay.
I
So,
agree.
so write with me. We'll just go through the bones of the hand, writing, put the specifics of them, and then I will leave you with them to just maybe read a little bit. Okay.
Okay.
So carpal joints, what are carpal joints? Between carpal bones. So they're called simple plane joints.
Simple plane joints. Okay, simple plane joints.
Okay, simple plane.
Joints. Wait, carpal. Simple plane joints.
So how those simple joints move is like they just friction against each other. That's it. That's how they move. Nothing else. Okay. Wait, just give me a second. The joint after that is carpometacarpal. Carpometacarpal. What does it mean? You have carpal bones attached to metacarpal bones. So this is carpometacarpal.
Carpometacarpal.
Okay. So carpometacarpal bones, they don't move a lot. Why? Is because of this ligament, deep transverse metacarpal ligament. You know? Because of this ligament. And however, they allow for all of those movements. They're like what? They're like ball and socket joints.
Ball and sockets.
Yes.
Ball and sockets.
This ball and socket joint, look, if I look at my finger, if I do this, see? The ball and socket. But it provides less movement compared to my shoulder. Why? Because of the deep transverse metacarpal ligament.
Yeah, see.
Okay. Before I finish, my link might switch off. So if I cut, I will restart it in 10 minutes. You just read, okay? But I'll let
Okay.
it cuts. Okay. Now, one unique thing about, so you have 5 carpometacarpal, right? 1, 2, 3, 4, 5. These we know, but this one is a little bit different. The one with the thumb. Why? Look,